Good morning and good afternoon. I'm Karen Cox, President of the American Academy of Nursing, and it's my pleasure to be here today to support the committee as you work on the future of nursing 2020-2030. I'm struck by today's conversation and the concept of high-tech, high-touch, particularly high-touch. We cannot escape the reality of healthcare today, this weekend's horrific events, and the broader societal context in which nurses will be providing care tomorrow and into the future. If there's any message that the Academy and myself can share, it's that we must remain true to nursing's compassionate care driven by science. Nurses will feel the weight of a mother's tears or provide life-saving interventions to communities rocked by trauma. As a profession, we must embrace science, technology, and innovation. It will make us better clinicians, but never lose sight of the human touch that makes us better nurses. The Academy is committed to creating a culture of health and advancing health equity through the generation, synthesis, and dissemination of nursing knowledge. Over the course of the 3 town hall events, we've heard the need to focus on education, research, practice, and care for complex health and social needs. But threaded through all this, and fitting for the last town hall, is the role of technology. Technology presents both opportunities and challenges, from increasing access to care in rural communities to providing parents the opportunity to see their infants in the intensive care unit. The merger of compassion and nursing innovation remains a viable key to success. For example, teleemergency, an Academy Edge Runner designated model, utilizes real-time video streaming and specially trained nurse practitioners in rural emergency rooms to deliver unscheduled care to communities that need it most. This system is available 24/7 for any type of consultation need for the ER patients. Designed by Christy Henderson, this model quickly became a gold standard to solving numerous rural healthcare issues. Another Academy Edge Runner model that was developed through the compassion of a nurse is the Angel Eye web camera system. This remarkable technology allows families to connect with their infants in the neonatal ICU through a continual video feed from the infant's crib via a password and a HIPAA-compliant website. Parents provide family and friends with secure access, and they can listen to the child talk, sing, or read to their infant while watching their reaction from a distance, and this helps with bonding. Invented by Dr. Sarah Rhodes, the system allowed over 2,600 individuals to connect with their infant at the University of Arkansas Medical Sciences over the course of 5 years. The success was so recognized by several companies. One actually took very big interest in it, and it resulted in another 579 Angel Eye camera systems being deployed throughout 28 hospitals in 14 states and 2 countries. Programs like this and others focus on technology integration will not become mainstream unless state and federal governments support their growth. This is equally as important as it is to the provider. The impact of the electronic health records on clinicians is well documented. Nurses spend up to half of their time completing clinical documentation. Dr. Patricia Singstack, a fellow of the Academy, conducted a study in which she found that the EHR required 593 clicks to complete all fields in a patient's assessment. This directly impacts a nurse's ability to give the high-touch care that is so desperately needed to ensure quality. The Academy supports the National Academy of Medicine's recommendations for a person-centric design strategy that promotes high-quality care delivery and reinforces team communication, as outlined in NAM's Solution to Alleviate Burnout discussion paper. In order to effectively communicate and engage with patients and their families for care coordination, nurses need to use forms of communication that patients will utilize, and it goes well beyond phone calls or a patient portal. To that end, additional guidance for privacy and security must be established, always with an eye of social justice top of mind. The Academy agrees that increased investment should be placed in high-tech innovation. Artificial intelligence, 3D printing, and virtual reality will have an increased role in the future with funding from private and public investors. But we must be ever vigilant on the ethical ramifications of these interventions and understand that this is healthcare's future knocking on the door. Nurses must be there to answer it and develop what is behind it. Technology is our tool, and we are the solution. I'm honored to be included in this important discussion, and the Academy and its fellows stand by ready to help. Thank you very much.
Thank you. Thank you, Dr. Cox. Joyce Sensmeyer, Vice President, Informatics, HIMSS.